In 1993, young healthy people in the American Southwest began dying from a mystery illness. At first it looked like the flu. Then came sudden breathing failure. Doctors were confused. Families were terrified. And within weeks, the CDC was investigating a disease that America had never officially recognized before. This outbreak would lead scientists to a virus hiding in plain sight, carried by a mouse almost nobody feared. So what really happened in the Four Corners outbreak of 1993? This video breaks down the 1993 Four Corners hantavirus outbreak using verified information from the CDC, medical research, and historical public health records. We'll cover how the outbreak began, why young people were dying so quickly, how scientists discovered Sin Nombre virus, and why this case changed disease surveillance in the United States. This is for educational purposes only and is not medical advice. If you have health concerns, consult a qualified healthcare professional. The story began in the Four Corners region of the United States, where Arizona, New Mexico, Colorado, and Utah meet. In the spring of 1993, doctors noticed something deeply unusual. Young, previously healthy people were becoming sick with flu-like symptoms and then rapidly developing severe breathing problems. One of the key early cases involved a young Navajo man who was known as a strong, long-distance runner. He developed fever, muscle pain, chills, headache, and general weakness. Then his condition suddenly worsened. While traveling with family, he became severely short of breath, collapsed, and was taken for emergency care. Doctors found fluid building up in his lungs. Soon after, another young person connected to him also died. The pattern was alarming because these were not elderly patients with obvious underlying conditions. These were young people who appeared healthy before becoming critically ill. That made physicians ask a frightening question. Was this a new disease, or had something familiar changed? At first, the illness was difficult to identify because the early symptoms looked ordinary. Fever, muscle aches, headache, fatigue, vomiting, and abdominal discomfort could point to many different infections. But the later stage was not ordinary. Patients were developing sudden respiratory distress and fluid in the lungs. Some deteriorated extremely fast. Local physicians and health officials began comparing cases and realized they were not dealing with isolated tragedies. They were seeing a pattern. The Indian Health Service, New Mexico health officials, the Navajo Nation Health Department, and the CDC became involved. Investigators reviewed medical records, interviewed families, and began searching for links between the cases. The early question was simple but urgent. What did these patients have in common? They lived in or had visited rural areas. They had possible environmental exposure, and many were connected to homes or areas where rodents could be present. That clue would become critical. By May 1993, the outbreak investigation was moving quickly. Samples from patients were sent for advanced testing. Early tests for many familiar causes came back negative. Then CDC scientists began detecting immune responses that pointed toward hantaviruses. That was surprising because before 1993, hantaviruses were mostly associated with disease in Asia and Europe, especially illnesses affecting the kidneys. But this outbreak looked different. It was attacking the lungs. The disease was later recognized as Hantavirus Pulmonary Syndrome, also called HPS. Scientists needed to identify the exact virus and its source. Investigators collected tissue samples from patients and also trapped rodents near affected homes. They tested the animals for evidence of infection. The breakthrough came when the same viral genetic material linked to human cases was found in Western deer mice. That connection helped solve the mystery. The natural reservoir was not an exotic animal. It was a common wild mouse already living across parts of North America. The new virus was eventually named Sin Nombre virus, which means virus with no name. This name was chosen after concerns about stigmatizing places, communities, or people. The discovery changed what scientists understood about hantaviruses in the Americas. Before this outbreak, many experts did not recognize that a native North American hantavirus could cause such severe lung disease in humans. The Four Corners outbreak revealed that hantavirus was not imported. It had already been present in local rodent populations. The conditions in 1993 may have helped increase risk. Heavy precipitation had increased vegetation, which may have supported larger deer mouse populations. More mice can mean more chances for humans to come into contact with contaminated droppings, urine, or saliva. But the key point is this: people were not getting sick because of who they were. They were getting sick because of environmental exposure to infected rodents. That distinction mattered because the outbreak also triggered fear, stigma, and damaging media coverage. The outbreak did not only create a medical emergency, it also created a social crisis. Many of the early cases involved Navajo people, and some media coverage used harmful labels that connected the illness to native identity or specific places. That caused stigma during a time when families were already grieving. Reports sometimes ignored cultural mourning practices and treated affected communities like a spectacle. This part of the story matters because public health is not only about finding viruses, it is also about trust, respect, and communication. If communities feel blamed or exploited, they may become less willing to cooperate with investigators. And without cooperation, outbreak investigations become harder. The Four Corners outbreak showed that accurate science must be paired with cultural respect. The disease was not a Navajo disease. It was not a Four Corners disease. It was a rodent-borne virus that could affect people through exposure risk. Understanding that helped shift the public conversation away from blame and toward prevention. The 1993 outbreak was frightening because many cases were severe and the fatality rate was high. Early reports from the Four Corners area showed a large percentage of confirmed patients died. Later, CDC summaries showed that Hantavirus Pulmonary Syndrome had been recognized across a wider geographic area in the western United States. The danger came from how the disease progressed. Early symptoms could look like flu, but in severe cases, fluid built up in the lungs, oxygen levels dropped, and the heart and lungs came under extreme stress. Doctors were dealing with a newly recognized disease, and at first they had limited experience identifying and treating it. Over time, awareness improved. Medical teams learned to recognize exposure history, warning signs, and the need for intensive supportive care. This helped build the foundation for modern hantavirus clinical awareness. Today, there is still no specific cure for HPS, but early medical care can improve the chance of survival. The Four Corners outbreak changed public health in the United States. Hantavirus Pulmonary Syndrome became a recognized disease. Surveillance expanded across the country. More hantavirus strains were later identified in North America. Public health guidance began emphasizing rodent control, safe cleanup methods, and awareness of rural exposure risks. The outbreak also changed how scientists understood emerging infections. It showed that dangerous diseases do not always come from far away. Sometimes they are already present in local ecosystems, waiting for the right conditions to expose human risk. The western deer mouse became recognized as the primary reservoir for Sin Nombre virus, and the public learned that sweeping or disturbing contaminated rodent areas could be dangerous if particles become airborne. The legacy of 1993 is not panic. It is prevention, surveillance, and respect for early warning signs. Key takeaways. The 1993 Four Corners outbreak began as a mystery illness causing sudden, severe breeding failure. Scientists eventually identified Sin Nombre virus and linked it to the western deer mouse. The outbreak changed American disease surveillance and revealed that Hantavirus Pulmonary Syndrome was already present in North America. This story is a reminder that public health depends on science, speed, and trust. If you found this helpful, hit subscribe and the bell icon for daily hantavirus coverage and public health updates based on verified science. Let me know in the comments, should we cover the U.S. states with the highest hantavirus risk, how rodents spread the virus, or the full timeline of HPS symptoms? Your questions drive the content.